Good evening, everyone. I'd like to reopen the public session for the school committee. Could we have, I have a reconvening at 7:31. And if we could stand for the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And if you could remain standing for a moment of silence as we consider the work before us this evening. Thank you. You may be seated. And if Mr. Levis, if you could do the safety notification for the public emergency exit.
Sure. In case of emergency, there are exits to your right and your left and in the front of the auditorium, to your rear, on the left or right, and also to the main foyer behind you.
Thank you. And Mrs. Colonian, if you could honor us by reading the mission of Coventry Public Schools.
Sure. The mission of Coventry Public Schools is to inspire, support, and challenge all students in an inclusive community to be critical thinkers, effective communicators, reflective learners, responsible individuals, and global citizens.
Thank you. And just to inform the public, the school committee met in executive session for about a half hour previous to this meeting, at which time we discussed matters related to the superintendent's contract, but no votes were taken at that meeting. That being said, is there a vote to seal the minutes of the executive session?
Madam Chair, I make a motion that the records of the executive session be kept closed pursuant to 42-46-4 and 42-46-5.
I second the motion.
And could we have a roll call vote, please?
Catherine Patino,
Yes.
Dave Florio,
Yes.
Luke Murray,
Yes.
Donna Colonian.
Yes.
James Pearson.
Yes.
Thank you. Motion carries 5-0. Moving on to agenda item number 5, which is the draft Coventry Public Schools reentry plan presentation and discussion. I would believe, Mr. Levis,
Yes.
you're on.
Yes. First, I want to thank those in attendance for coming. This is also live stream on YouTube, and it also be recorded. The presentation that I have here is also on our website under news, and you'll see the presentation so you can follow that. And it's a draft. And the reason it's a draft is because we're still in the processing of development. So this should take about 10 minutes, and then we'll open it up to questions. So the process we followed, I don't know if those of you remember last year, we pulled together, we did reentry planning from June of 2020 all the way to school started. This year, when we started, finished the summer or started the summer, I think we all thought that, masks and everything was behind us. And so when we had discussed with the Department of Education, the federal government required a reentry plan, but it was explained to us that the plan really was for those states because there are still many states who hadn't gone back to school. And so our expectation was we had already done the work and we'll submit a document, but it was indicated it was going to be very light lift. The plan also, and the commissioner was clear, was for all students to return to in-person learning. Now, there are exceptions based on medical or special education, but the plan in our plan has been to return all students. I think we recognize that kids need to be in school, parents need to work, and hopefully this summer, was a fairly normal summer for many people. We build off that work that I just described, that we had over 50 stakeholders putting together last year. Big part of this is mitigation strategies, how we're going to attack, prevent the disease, the virus from spreading. We had to submit a draft by August 13th, last Friday. We had about a week to work on it. So this is why this is a draft. I'm going to talk about a lot of areas, and we're still developing those areas. The complete document will be published before next Friday or next Saturday. And most likely we'll have it present so that we can go over it at our school committee meeting. Tomorrow, I have a meeting with our administrative team and key stakeholders. I was on the phone with the Department of Education, the Deputy Commissioner on Tuesday. And yesterday, I was on the phone with the Department of Health. And then we had a conference. There's a lot of movement, a lot of changes are going on, as you knew here today, or if you haven't heard, the governor passed an executive order mandating when we start school, universal masking. That took place today around 2 o'clock. So this is still a lot of moving parts. I'm going to meet with our school nurse teachers, our special ed director, Mr. Wilson. We're going to meet Monday to go over our specifics around our testing plan, protocols and procedures for entering a school facility during a public health crisis and other health-related procedures. The last school committee meeting, the school committee voted to allow the superintendent to use administrative directives on requirements for entering the building. So we'll incorporate the executive order, attestation, which is where in the past we used to have parents have to fill out every single day, teachers every single day. We're going to go back to having people do it once, just saying that you will monitor temperature, you won't send your child in sick. The same with our staff to make it easier. We're not trying to burden people. We know these continue to be challenging times. And then our final plan, as I said, will be posted on our website by next Saturday. But our plan is to get it completed so that we can present it at the school committee meeting. So the focus is on these 4 areas: health and safety, instruction, social, emotional, and mental health, which we feel is just as important, if not more important. I don't know about yourself, but if I'm just not myself and I'm stressed out or anxious, I can't be the best self I can be. I can't focus. And so we recognize that. We had a workshop today. We had over about 110, 115 of our staff talking about trauma and what we've been through this last year and how do we prepare ourselves to move forward. So, and then the operations. What is that? The day-to-day operations, whether it's transportation, food service. We need to look at what kind of accommodations are we going to need to be making. So the health and safety. One of the things is we had a vaccination clinic here last night. We had about 62 people. We had, I think, 17 staff members, including one of our school committee members, our facility director. We had nursing students. We had 3 nursing students and their instructor that were present. So we had a lot of people supporting it. I think I said there were 62 people in the community that received their first vaccination. And so, we're going to do whatever we can do to promote. We've held clinics, vaccination clinics in school. If they offer booster shots and we're able to do that, we work in conjunction with our local EMA, which is the, Jill Dabrowska and Chief Rick Heiss, the chief of police. They coordinate it and we try to support that. So we'll do whatever we can do to support the community becoming more, vaccinated if people choose to. We talk about physical distancing. That was a point of contention with us last year because we don't have 6 feet between students when we have everybody back in. So we have to use this layering approach. We talk about face coverings. We were going to be talking about this Monday with our nurses. Now there's an executive order. So we'll still be discussing it and putting together protocols. I mentioned the attestation plan. It's making sure that employees and staff and visitors don't come to school if they're feeling sick. Cleaning and disinfecting. We put on, I believe it was 8.5, 9 custodians last year. We kept them on. We use electrostatic spraying of all areas every day. We do multiple cleanings per day of high traffic areas such as bathrooms. We do like doorknobs. So we think that's very important in terms of, mitigating this virus. We're going to focus again on contact tracing and quarantine. The state is, I mentioned there's this playbook. I had a conversation with the Department of Health. They're changing the rules as we speak. They're looking at, what's considered a close contact. I'm sure many of you, if you're parents or grandparents, at one point, probably your child was determined a close contact, or maybe you were. And so we really want to be clear about what that looks like. What is that? We also want to be clear around contact tracing. Who do we need to contact trace and get that done Quarantine's another, in the past quarantine, if you're vaccinated, you don't need to be quarantined. However, if you're unvaccinated, we used to do 14 days and we dropped it down to 10. Now it's 7 days with the test. So that if you get tested, I believe on day 5, you're able to come back on day 7. We're hoping that we can, mitigate this as much as possible, and we'll make sure that all these specifics are communicated. Concurrent learning for students on short-term quarantine. We're going to be teaching students, and they'll be working along with their class if they're out for, 5-7 days. Long-term absences, we're going to deal with on a case-by-case basis, and typically those will be, medical, somebody that has either a physical or mental impairment and is eligible or requires some type of accommodation, or through a special education process, a student, because that would be considered a placement change, and then the family would have to work with the special education office to have an IEP meeting and look at what the needs of the child are. And then the communication survey. At the end of last year, many parents, I think it was over 655 respondents, and this took place like in 2 days. So Mr. Coward, our assistant superintendent, sent out a survey. And the most important aspect, other than keeping your children, keeping our staff safe, is communication. Making sure that we communicate with you on a regular basis. Any changes, what's behind our thinking in terms of our decision-making. So 51% of the parents said that they visit our school website regularly. And hopefully you've looked at it recently. We have a new website. In fact, the company School Point that we purchased the website from that helped us design it, they've actually purchased another company, and it's going to be even more enhanced. We have an app with it. Is that out yet? So that you can have it on your phone and have access to all this information. 93% reported receiving our robocalls and text message communications. We try not to overutilize that. We want people to know when they get it, it's an important message. I was in a district before where everybody used it all the time, and because of that, parents asked to get removed from the list. So we want to make sure that we don't abuse our ability to communicate with you, but it was exciting to see 93% of the people report listening to that. Emails was 84%, notifications. 83% follow our Facebook page of the respondents. So we saw 12%, 8% follow YouTube, and then 7% follow Twitter. Participants report getting local news from the internet, TV meetings, and radio. Many commented that they're satisfied with our communication strategy, but we're going to put out another survey because we want to make sure that we're giving you the information that you want, and we're giving it to you in the manner that is best for you to receive. So we'll be doing that. And the reason we tied this in with health and safety, we think that two-way communication is the most important thing we can do. While we won't always agree with each other, I think it's important that we work together as a team. I believe that we've done that, and I appreciate your support. And we're going to need that again, working together, at least for the start of the year. Again, this is a draft. These are some overview. So instruction, we use data in terms of looking at how students are performing. You've heard a lot about learning loss. So we're going to use some of these, some of the instruments, STAR screening and secondary measures, programming due to illness or quarantine, concurrent for short term. So we have special programs, and we're going to work with specific students and families to make sure that we're going to provide you the support and the resources you need during those times. We're going to monitor learning through our STAR screening, our interventions, and then we have what's called a multi-tiered system of supports. Years ago, it used to be this, wait to fail kind of model, at least people's perception that students did really, really bad, and then they got a referral to special ed, right? Well, that's not our job, but your job as a parent. We want to make sure that as soon as we start to see a student struggling, we're able to put supports in place. And that's what this multi-tiered system of supports is, that as soon as the student starts to struggle, we can bring that information, that data to a team of experts and try to think about what kind of intervention can we put in place, right? So we want to look at what the need is and meet it with a resource. And so we have those teams that operate in every single one of our schools. And so we'll be using that process also to look at students that are struggling, not only academically, but socially, emotionally, behaviorally. So we talk about remediation and intervention. Again, we And if you followed our school committee meetings, our school committee authorized us, we received federal funds and we're able to use those funds not only to hire additional custodians, we've also hired additional floating nurses because we find when you're in a public health crisis, having nurses available to support, we couldn't have made it without our nurses last year. They were amazing. Many of you probably spoke with them. So we, on top of those resources and personnel, we also put on numerous academic positions, math interventions, reading specialists, special educators. And we also had modified the schedule at the middle school that the teachers and our administration worked together, and we put in a schedule that is focused on giving more time and more resources to students. So I want to compliment them on doing that. We're also going to be doing what's called high-density tutoring. We had provided some supports and funding for this summer. We weren't able to hire all the staff we needed. And what this will be is we're going to target students in reading, writing, and math. And we will look at providing them consistent tutoring so they build a relationship with an educator. And it'll be tied to the curriculum. So it won't be something that's completely separate. And there's a lot of research on this, how effective this is. And we plan on continuing that. So if you have a child that's struggling in those areas, we can provide these supports at no cost to the parent. We even have money that we can look at providing some transportation, like a late bus type of transportation. I'm looking at our finance director. He didn't know I was going to say that, but I know we do have some funds, Mr. Sands. So we'll talk about that. But again, this is another way we can provide the support that children need, that additional support. And one thing we did this summer, I've had a couple of emails where, we had paid for a camp for individuals that went to the YMCA. We helped supplement that, or also to the recreation program. And what's interesting about that, we wanted students this summer, and it ties into social emotional, we wanted them to have some normalcy. But plus, as a parent, many of you, if you did distance learning, your children with you every single day, you needed some normalcy too. You needed a break. And I'm happy to say that we had, I don't know the total count of students, but we had numerous students that went both to the Y camp, that went to the rec program. But the best part of this is we were able to provide 5,000 meals a week to our students in this community through the help of Sodexo at no cost. So they got breakfast and lunch. Every student that went to the camp, we were able to provide every single day. We did our drop-off once a week where families would get 7 days of breakfast and lunch. We're going to continue throughout this year with the free meals. We're not going to be able to do the pickup the 7 days a week. The meals will come through the school, but if somebody is homeschooled, we're able to work on an arrangement where they could come to school and I talked to Sodexo, we could give the meals for that. So I think that's something that people don't recognize, but to be able to provide 5,000 meals a week throughout the summer to our community, to our young people is just amazing. Special education, again, those supports continue. That's a process that, throughout this pandemic, I think we did an outstanding job addressing the needs of our families, having meetings. In fact, I think the virtual meetings were probably more convenient to parents, a lot less intimidating coming in. I know as a special ed director, coming into a meeting and seeing a parent come in with 12 or 13 people sitting around the table is very intimidating. And so there's a lot of practices we learned that were effective during the pandemic that maybe we can continue, but our special education programs continue to provide supports and services to students who are eligible. With staff supports, we have an incredible professional development committee that's really been working on differentiating, not one size fits all for everybody. So while there's training that we're doing for everybody, I mentioned before, we had this trauma informed workshop today to help our staff just process what we've been through and prepare themselves from a traumatic lens, looking at it from a traumatic lens. We have to drill down to, individual professions, individual areas of skill development and of need. And so we're going to focus not only the academic, but the social emotional, and continue to provide the resources, whether it's curriculum materials, whether it's the professional development, training, bringing in consultants. We have a commitment to our staff to do that. To help your children, we need to make sure our staff has the tools to do that. We can't just say, we hire you, go in the room and do your job. That might have happened 50 years ago, but that's not the educational world we live in today. social, emotional, and mental health support. I'm a firm believer that that has to be a primary responsibility of our schools, that we need to make sure that our students feel safe, that they feel, respected, that they feel loved by their staff, by their teachers, that their voice matters. And we've made that a priority. I mentioned before about our summer programs. My goal, and not that my goal, but with my colleagues, we talked about with the committee, is making sure that students had as normal a summer as possible. They need to get outdoors. They need to participate. They need to be with each other. And so I think we did, not only did we provide those social emotional type of programs, but we provided a lot of students academic support. And many of you, if you're middle school parents right now, you know that the high school's running these career tech exploration programs. And I can't tell you how many emails I received about we have fifth graders exploring, culinary arts. There's a crime, it's CSI, it's run through our criminal justice program. We had welding, students go into welding, computer science. So it's just amazing to get exploration, to think about what their future may be like. So we did a lot with the summer programs to support students. And the other part is that this isn't just an internal, work. We work with a lot of partners. We have incredible social workers, psychologists, guidance counselors, our SROs, Officer Nickerson back here. He's been amazing support, both at our middle school and our high school, as all of our police have been. But our SROs are a big part of what we do in terms of they work with families. They've gone out when a parent has called and said, I'm struggling, I can't get my child out of bed. And they've gone with maybe one of the deans from the school and assisted. They've really changed a lot how people look at, our students look at working with police, and I want to thank you. But we partner with Thrive Behavioral Health. We have an individual that spends, I think, 10, maybe more hours this year. They might spend 20 hours in our district, and they're a licensed mental health clinician. Too often we have a student that is in crisis, and we end up having to call, we're concerned about their safety, and we end up calling a rescue. And it's very traumatic. Going to our hospitals, we know our hospitals aren't the best places to send children, but our hands are tied. Well, now we have an individual where we can call and can do that type of assessment and maybe work with the family to get them seen so we can avoid that traumatic experience. So we have that available in our schools. We have a comprehensive community action program, CCAP, which provides a lot of services. They also provide the 7 challenges. We have this treatment program for middle school and high school students that is a very flexible, evidence-based treatment program where students can, recover from a substance right while they're continuing their education in their own public school. We work with Tides Family Services. They were instrumental in helping out a couple of elementary families. I'm going to talk with our special ed director about maybe working with them to do outreach and tracking. We have a lot of students that struggle maybe coming to school. There's true, absenteeism. We want to be proactive and therapeutic. And so right now we use our truant officer, our school resource officer, our deans, but we could hire this organization with federal funds that we have that could be proactive and support the families, because we need to support the families, not just the students, if we want the students to be successful. We work with the Coventry Department of Human Services. Mr. Robillard is a great support. That program to our students and our families. Family Service of Rhode Island has been working with us on trauma-informed care. And they're working not just with the school side, but with Mr. Rolba, with the town. We have a Family Care Community Partnership. That's called FCCP. That's pre-DCYF, where families are struggling, students are struggling. Before they get involved, there's a lot of fear about getting DCYF involved. This is a proactive therapeutic intervention program that's available to families in Coventry. And I had mentioned before our school resource officers. And I'm sweating on my keyboard, so I'm struggling with my mouse, so I apologize. Reopening operations. So facilities and maintenance, we will have, the CDC has protocols and guidelines around cleaning. We follow those. All of our custodians have been trained in these protocols. We will be putting out building-based procedures. Some parents have asked me about drop-off and pick-up. in different schools versus last year. We will be communicating that to you very shortly. Transportation, whether or not the governor mandated or whether or not we put in a universal masking, everybody has to wear masks. And if you've flown or traveled, on buses, you have to wear masks. Our students will need to wear masks on the buses and in health centers, which means in our nurse's office. But the fact that we'll be universal masking. And of course, we're going to have to build in, like we did last year, it's not on my slides, but masking breaks. I hate wearing a mask. I couldn't believe that when I heard about the Delta variant, it was in India. And, the first time I heard, hopefully it doesn't come to this country, Unfortunately, we've heard that before, right? We heard that with COVID and when the outbreak in China, and hoping it didn't come to our country. But we need to make sure that we know these are difficult situations. We can keep saying it's not forever, which it isn't going to be forever, but in the moment it's challenging. So we will make sure that we do whatever we need to do to accommodate our students in terms of taking breaks. And then the last part of this is the technology that if you've been in our schools and used wireless, Mr. Murphy is our tech director. He does a phenomenal job, but we've had limited resources. Our wiring, our wireless in our schools the wiring was done like in the 90s, I believe. And so we've recently, with federal funds, matching federal funds, we're able to revamp the wiring and the wireless in all of our schools and all of our facilities. And I think we'll see a great improvement as we move forward. We just received, I think it was like 1,300, am I right? About 1,300 Chromebooks that we received that we've distributed to our elementary schools. If any of you have elementary children and use some of the Chromebooks, they might have been 6-year-old Acer Chromebooks that we had sent out. And we try to maintain them, but their life expectancy is over. So we were able to purchase those. And then we also have hotspots for connectivity. We recognize that some parents, some families aren't able to have internet. And, maybe you can use your phone as a hotspot, but you may need your phone. And if you've ever done that, you see how quickly it drains the battery. So we have hotspots for connectivity that we've provided to families at no cost. But also, I was just informed that Cox and Verizon have a program, and we'll be sending out information. It's not a no cost, but it's extremely low cost money program. It's federally funded this time. Before they did things out of the goodness of their heart when this happened, but now these are federal funds, and we'll share that with families because if you haven't been able to afford internet, this might make it affordable. It's very, very inexpensive. But again, we want to make sure that every family has access. So the last part I was going to talk about, and it's probably has less of a magnitude than it would have before 2 o'clock. At our last school committee meeting, the school committee authorized the superintendent to work with our medical professionals who are in our schools, are really our nurses, to look at what are the protocols that we're going to put in place for students entry into a school facility during a public health crisis. And then we have a policy that's the same for employees and visitor entry. And this would be like attestation, wearing facial coverings, maybe temperature taking. And so we were going to be meeting Monday anyways. Now we're going to be meeting and looking at how we incorporate, what are all those procedures we need to put in place for students, for visitors, for our employees. And I will put out what's called an administrative directive. We also have a policy around student dress code that I had put out a student administrative directive last year that talks about facial coverings and what's acceptable or not. And that will be disseminated again. And then the second part that I wanted to highlight is you hear a lot about ventilation and air quality. We were one of the first districts last year when this became a topic of concern to hire a company. It was Creative Environment Corporation. They came out and looked at all of our ventilation systems, HVAC, and did an exhaustive study. And one of the recommendations was called balancing. They go into our individual units in our classrooms and we wanted to make sure that there's 4 air exchanges per hour. Now they're saying 2 to 4. But what we did is we identified a minimal amount of classrooms throughout the district. And in those classrooms, we're installing HEPA filters to ensure that we have proper ventilation. There's a lot of complaints about the middle school. And if you go in the middle school, you're going to see we have incredible humidity. There's, if the ventilation system falters for a day, you're going to find that there's just moisture everywhere, mold. We have our air quality, we have that tested on a regular basis. But with COVID, we found out that humidity is our friend, right? The droplets, the moisture just grabs onto the COVID, the virus, and just drops it to the floor. So while it's uncomfortable as can be, we've done, I think, an exhaustive job looking at our air quality, our ventilation systems. We put in these ERVs, which are energy recovery ventilator air exchange systems, and we put systems in at Western. We found out that there was ventilation areas where we had no ventilation because the town had run out of money. The district had run out of money many years ago. We corrected that. We have air scrubbers. These are these big machines. They look like snails. We have covers on them. And these large HEPA filters, they will be going in our large spaces at Tyoke, Black Rock, and Hopkins Hill, in our cafeterias and our media centers, to make sure that we have the proper air quality. We're having these ERVs installed. Right now, the plan is to be installed during the winter, during our winter break. We had ordered them before, but with the COVID, there was such a supply issue in the United States, whether it was they didn't have them or they couldn't get them shipped. So we'll be taking care of that, but that's one thing. We also use filters. We had put up filters in all of our systems. We changed the filters to what's called 13 microns. It's very, very, very tiny, and it captures the virus. So we've replaced those, and we'll make sure that we replace them on a regular schedule. So that's important to know because air quality is crucial. So I'm going to take questions and comments, but I just want you to know that there's still a lot. I received what's called the playbook. I received it after 2:00 today from the Department of Health. It talks about guidance, and I haven't had a chance to look at it. I shared it with our administrative team. Hopefully we'll look at it tomorrow as a team and incorporate that. So it'll talk about, there's some guidance around, some concern we have, and rightfully so, is cafeterias, right? Because our plan was to come back full and just eat in cafeterias. But how are we going to do that? We need to look at what we did last year, what we're doing now. And so we'll be revising that. Looking at and revising this plan. And we will have this plan, like I said, my goal will be to have it by the next school committee meeting so we can make it public where it's comprehensive. As always, we'll put it on our website because it's important to know what school's going to look like when students come back. So that's the presentation. Probably went longer than I planned, but I will be open for any questions.
I'd like to start with the school committee, and then we'll bring it out to the public. Mr. Florio, any questions for Mr. Levis?
Mr. Levis, you and I had the pleasure of working the vaccination clinic yesterday. And I was speaking to some of the parents and children who were waiting for vaccinations. And one girl was an 8th grader. And it stuck out. I said, "Are you looking forward to going back to school? You're going to have a great year this year." And she said, "Yeah, that's important to me. I did well on the Chromebook and learning from home. But what I missed most were my friends." And she said, "That's what I'm looking forward to. I'm looking forward to having fun with my friends." And that's something you were aware of. That's the emotional part of the separation of the child from the school. And that's not the first time I've heard that, but it's the first time I've heard it from a child who goes to Allen Feinstein Middle School. So I think you're on the right track, Mr. Levis. Thank you.
Thank you, Mr. Florio. Mrs. Colonian.
Mr. Levis, thank you for the presentation and putting this together. It was, I enjoyed it. I think that you're on the right track, and I support you.
Thank you, Mrs. Colonian. Mr. Murray.
Thank you for the presentation. It's informative. Unfortunately, a lot of the substance, as everyone knows here, a lot of this is coming down from the state. Unfortunately, just like last year, it's coming down late. It keeps changing, and I know that's very frustrating for parents, including myself. And as a school committee, it's frustrating, right?
Yes, it is.
So I want you to know before, as you make your comments, we hear you. I'm there. One of the things, well, I guess one of my questions is, and this goes into normalcy, right? Last year, we didn't really have the ability to have some sense of normalcy, right? Everything was restricted. So I take my own child in the middle school, masking in the same room, lunch at the desk, 5 hours, 6 hours a day. I know by the end of the year, we weren't even taking them out quite as much as they were. And I don't know why that is, but I know she had mentioned it to me. So I guess, can you comment to the sense of normalcy? We didn't maybe see some of the components, right? So we talk about layering and masking and hand cleaning, everything. How are we taking a layered effect to make things more normal in the school environment that maybe they didn't have last year?
Yeah, I think the first thing though is that if you remember last year, we started hybrid, then it was 4 days a week. And then for the middle school and the high school, they came in towards the end after April vacation, but that was like a month and a half, 5 days. So we're starting off with more normalcy. And the challenge is, and to be, completely honest, that we didn't plan on doing this reentry planning this way. This reentry plan was supposed to be just, really, it was about what other states that hadn't been to school what needed to do, because the federal government wanted to make sure, not that, it should be up to the government, but we wanted to make sure that kids had an opportunity to be back in school. Because some kids have been out for the end of what it was, 19, right? Into 20, and then out 2021. I went to Palo Alto in April, and it was mid-April when some of these students had just been back into a classroom. They'd been out 13 months. And there were states where students, in districts where students hadn't come back. So long story is, we're starting off at a much better place than we did last year. I think nobody wants to wear the mask. Nobody wants to hear about the mask. I get that. The last thing that I thought we'd even be talking about was masks. So some of this we'll be having conversations. I'm meeting with our administrative team tomorrow. My focus for this year, this summer, and I think many people, was I wanted to make sure that our staff had an opportunity to take care of themselves. And I include our administrative team. I've tried not to burden people, pull people together for meetings. We had our first meeting on Friday the 13th at the Naughty Oak Room. We had a administrative retreat. So we're hitting the ground running, and a lot of this information will be coming out from our administrators, our principals, in terms of the individual building, how the middle school will handle certain things, how the high school, and we're still talking about that. So I think the goal for all of us is, we want to get everybody back in. We want to keep them safe. What does that mean, right? Like, what does safe mean? We try to balance that. And we're still working on that. And, ask people to be, patient, because next week, we don't have much time. The guidance from Department of Health just switched yesterday. I just received some document today. I haven't even looked at it. So we need to incorporate that in. So, but I think those are great questions, and we want kids to be back. That comment that Mr. Florio made about kids wanting to be with their friends, we don't want it to be a sterile environment. Last year, we were looking for a sterile environment. Like, the focus was just on cleanliness and keeping kids apart, and we've learned a lot. So this is all about balance. But the challenge is we're finding out more and more about this Delta variant daily too. So I wish I could tell you it's going to be as normal as possible. I mean, it will be, but I don't know what that definition of possible is. So I ask people to stay tuned. And that's why we stress the communication piece. You may not like what we do, but we promise to make sure we communicate. This is what we're doing and the why.
No, that's fair. And I think the overriding thing is that we're trying to return to some sense of normalcy.
Yeah.
I'm hearing, right? And so mask, no mask, we talk about layering in those activities, making sure the kids, and the biggest thing for me as a parent is making sure my child stays in the classroom, right? So the overriding thing for me, whatever keeps the kids in the classroom the longest is a priority, right?
Right.
Making sure they don't because we had tons of kids. People don't realize last year how many kids were put out, how many students were put out for long terms, even when we went back. So we went back and I had parents calling me, why is my child out for 14 days? and they're on a bus, they're in proximity, right? And so we have 20 kids out of the classroom. So that's frustrating for parents because the child might be perfectly healthy, but now they've got to stay at home in their room on a
Right.
computer learning. So the other thing I just want to point out, and obviously the committee members know this, but I always like to go back to the actions taken in the previous year, right? And I think it wasn't perfect last year. I know parents probably have, their qualms, but I think we did take action. I do want to commend the superintendent on especially the HVAC, because he was the one who actually took initiative early on, one of the first school districts to do that. And I think we're seeing the benefits now where we're going to see the result of that this year, because as we know, Delta hopefully will be a bump, I'm hoping, in Rhode Island. And because of the air quality maneuvers we've done as a community, we may, depending on the governor's orders, be able to peel back faster than other communities. That may be because of the things that you've done put in place, that layered approach, right? Because masking is one part of that layer. So we've done that, the Chromebooks, which we've invested in out of the COVID funds, the summer camps, which quite frankly, I was skeptical, but my daughter came home today and she went to the criminal justice. She had a great experience, and seeing my daughter, who has been a little recluse since COVID, go to the culinary arts, try that. And I'll maybe the first to say I was a skeptic approving those funds, but seeing a child, the effects on them, it changes things, right? Changes your perspective. So it's changed my perspective a little bit on that, and understanding that we can't necessarily take 4,000 plus students and they all have that same experience. But if we can have an effect on some, it matters. And so we know that all the little things that we do matter. It's taking it in chunks, right? We're not going to affect every child through one program, but through these multitude of programs, we're trying to take action. So I appreciate that as a school committee member. And I also bring that up because once again, we'll be back in the budget season, and things like having custodians this year, which we didn't have, which we paid for through COVID money, is going to matter again in the layered approach, right? Having full staff to be able to clean those doorknobs and do the sanitation is all going to matter. And I hope, again, that layered approach, we can start peeling back the mask when we get to that point. I'm
Right.
hoping, I don't know what this executive order is going to say. I'm hoping there's a little bit of flexibility on a community strategy to say if the numbers go down either in a region or in a community, that there's the ability to peel back and maybe respond a little bit more nimbly to that. And if we have that ability, I think as a school district, we've tried to set it up so there's other precautions in place so we're able to do that comfortably, right? So, and I hope we can continue to do that. And then I know there's some discussion about using outdoors more, Mr. Levis.
Yep.
Could you just talk a little bit about that to me? I know it's not worked out, but the overall overriding goal.
Well, I mean, one of the comments that was made on the meeting with Department of Health yesterday was, I'll give you an example, like, people are concerned about cafeterias and they said, well, just go outdoors, just eat outside. Well, that's nice and easy to say, but there's two issues. Sometimes it's the number of kids you have, students, and the inability to supervise, or just the feasibility of the logistics. And then there's a thing called weather, right? Like today wouldn't have been a good day to eat outside. So we talked about tents. We're looking at getting tents, and I talked to an attorney. We can do it through like an emergency. We'll still need to get quotes because we tried to lease tents, and even if they don't use them for lunches or whatever, we know that there's going to be a push to be outdoors more, especially if the weather is nice. But we need to accommodate that. So we can do it under an emergency purchase, and I'll share that information with the school committee. But Mrs. Sands has been working hard to try to get access. Like I said, we tried to purchase tent, to release them in the short term, and we weren't able to. We found out there's a labor shortage, no surprise, but with the tent rental agencies, it's crucial because they need to install the tents for their insurance. And so, because we have incredible custodians and we could get them to do it, and they've been amazing, but we can't do that. So we want to create an opportunity to be more flexible. Last year, we couldn't, by the time we were able to rent the tents, when we thought we had some funds to do it, they said we wouldn't even have them for a month. They wouldn't let us have them from November. So we're looking at providing those opportunities and spaces available, because we know that our teachers appreciate that, especially in our elementary. I mean, in middle school, they would go out. I'd see teachers out a lot, but it's conducive on the weather. So if we can provide some areas where people can go and it's sheltered, and I feel like that's our responsibility to create as much usable space as we can. So that's what we're looking at in terms of making it more flexible, but we need to provide those resources because everything else is weather dependent.
Yeah, so I mean, I guess from the schools committee side, if there's anything we can do to support that, getting the kids
Mhm.
outside, I know we have some funds available.
Yeah.
And it
Yes.
may even be that we look at permanent shelters, right? These are things that we can use long-term. We didn't expect the Delta variant, but had we installed something permanent last year, it might have reaped benefits this year. So it's not unfounded that the cost of a rental tent for that amount of duration could pay for an outdoor, having a recreational background myself in the construction industry, might pay for that type of long-term shelter, especially at elementary schools where we could maybe even have events under that PTA, PTO type thing. So, I mean, we do have some funds available. But I just urge you to think creatively on that, because anytime we can get these kids unmasked outdoors, and I think that's long-term, maybe that's an adaptive strategy. Long-term, even long after masks go away, there's nothing wrong with fresh air. So, and I'll leave mine at that. James?
Thank you, Mr. Murray. Mr. Pearson.
Lean-tos and gazebos. That's what I hear. No, but maximizing use of outdoor space is always a good idea. Of course, we live in New England, can't do it year round because of temperature swings and snow and tropical storms that we're getting this weekend. So I agree with that. Mr. Murray made a lot of good points, asked a couple of things I was going to ask about returning to normalcy, which is a priority. How to return to normalcy in a safe manner for these students. I think it's been skirted around but not said, and I don't know if everyone in attendance knows, but the governor did push out an executive order mandating masks. That decision is no longer in our hands. As Mr. Murray pointed out, don't know what the language in the executive order is going to say yet, but reading past executive orders, it's probably just going to be a blunt tool that they'll revisit every month or so or something like that. That seems to be the MO. Looking forward to seeing the detailed plan next week. Will we get an advance copy of that before it's published?
Yeah, most definitely. I'll share it with you. We still haven't received feedback. I think my phone calls that I had with the Department of Health and the Department of Ed, I mean, most people, I don't know if you're aware, but the Council of Elementary and Secondary Education came out with a directive to the commissioner not to accept any of these plans with the policy, without a masking or face covering policy. And, we didn't skirt that. We didn't create a policy, but we have policies that allow us to implement that or allow the superintendent to do that. And that's what I explained to them. And our goal too, and I'm hoping, I haven't seen the executive order, but I believe I have a link to it so I can pull it up. Our goal is to do this on a regular basis. This not until further notice, but I'm hoping that it allows us to look at certain variables, because I think people need that. We need that sense of hope. We need to know that we're not going to have a whole nother year of this. And I feel that if we can do that in the language we put, it doesn't mean that if we revisit it, say mid-October, the end of October, it doesn't mean it goes away, but at least there's a benchmarking process. And I think that's important. And, as you both talk about going back to normalcy, I think those are the things that we need to look at, saying we are going to assess. We did, and even last year, at the end of the year, if you have anybody involved with the high school, you'd see that our seniors had a really good end of the year. I went when they were at Gurney's down in Newport and had a great senior day. If you went to the graduation, it was just a wonderful event. A lot of hard work, but we tried to put as much normalcy. So this, I like the term, this is kind of a hiccup or a bump. But we have to look beyond it and know that the end will be there. At least that has to be my mindset. And I think that's how we have to communicate it to our families. So we will definitely, however, if we can word it so that there's benchmarking, we'll definitely do that. And I'm not talking about the rate of the virus. I'm talking more that we'll just assess this and this date. I think that's crucial so that people know we're going to have a conversation about it. So.
Yeah, speaking firsthand as a parent, it was definitely a challenging year last year. And not one particular thing, it was just everything combined, and no matter what time of year. Kudos to the kids for really putting up with it because they had to. It was the right thing to do. And thanks to everyone, all the teachers and other staff for making it work, because challenging for everybody, parents, students, staff, everyone. Again, also, Mr. Murray hit on the air exchange and the filters and being on top of that early. I think that was probably one of the better things that came out of last year, is being on top of that early really helped out. And so just continue to be on top of that and making sure that we have clean air to reduce the spread of virus. And because I'm a nerd, Mr. Levis, I will forward you an article I recently read. I do this to my boss too, by the way, about the aerosol science and how 80 years of aerosol science was based on a faulty data point, has to be revised. It's an actual scientific paper. I'll send it over. It's light reading. That's all I have. Thank you.
Thank you, Mr. Pearson. I don't have anything much except to say I'm looking forward to the detailed plan. And I just want to follow up with the fact that I believe that there are some really capable people in this district at central office, out in the schools, our nurses, all those people working together, I trust will come up with a plan that provides safety and health and safety as the #1 priority. Obviously, education is up there as well, and we do want to have some kind of normalcy, but you can't do that if you're in the middle of a pandemic. So I trust that the plan will be the best plan that you could possibly come up with. I know you guys have worked really, really hard. Last year, you worked really hard coming up with a plan, and I believe that the same thing will happen this year. And again, I think we know it's a moving target. That's why even the health department, has come up with plans, and then you hear something different. You listen to this, and then this happens. So it's a moving target. So I think the flexibility that we're allowing here with our policies really makes a lot of sense. Things can change in a week, and without having to have an emergency school committee meeting and have us all vote on something, administrative directives and giving the power to our superintendent and his leadership team makes a lot of sense for this community. I've had multiple colleagues across the state say, wow, why didn't we think of that? So, because it makes a lot of sense to do it this way. So again, I want to thank the superintendent and the leadership team for last year's work, and obviously for this year, because we're gonna be in for a little bit of a haul. I'm hopeful that things will calm down, that the Delta spike will come and start to come down again, and we'll get some ability to maybe pull back on some of our requirements. That being said, I'm going to open it up to the public. If you would like, I don't think we have a mic. Oh, we do. Oh, I completely didn't see it. So if you come up to the mic here and state your name and your address, you're welcome to do that. So we're open for public comment. Again, state your name and your address, please. Thank you.
Yes, yes, it's the playbook. We'll put it on our website. Like I said, it's available in the Department of Health right now, but we have a playbook on our website. We'll update it. I just want to look at it and read it, and because we have to incorporate, I have a meeting tomorrow with our administrators, but yeah, it's definitely a public document. So I haven't even opened it. It's an email I forwarded right away when I received it. So, but we'll definitely share it. Like I said, it's through the Department of Health, but we'll make it easy for it. We'll just put it on our website. There you go. Sorry.
All right, sorry about that.
No, it's,
You mentioned a moving target. I think that's one of the problems. We started off with 2 weeks to slow the spread. We wanted to keep hospitalization down at least to a manageable level. Most places were able to do that, and now it seems like we want to eliminate the disease altogether. It's not going to happen. Okay, we've got the Delta variant now. We're going to have an Omega. We're going to have this. There's going to be variants coming along. In some way, shape, or form, we've got to figure out how to live with it. Okay? Kids in general are not dying of this. Okay? There have been about 430 kids overall in the entire country. The population of 75 million who perished from this disease. Every one of those is a bad thing. Okay? But when suicides are over 3,000, okay, that's even worse. Okay? And we're going to see the mental health of and we've already seen it in a lot of cases of our kids decline. Okay? And not just with suicide, which is probably the end game worst of it, but we see it Mr. Levis talked a lot about intervention.
Mhm.
And we're having to see more and more and more of that, if I'm not mistaken. Is that correct, Mr. Levis?
well, I think we recognize that mental health is just as important for not only the children, but the families. Everything that I listed there is about family support too. So I don't disagree with you saying, but I think we're taking action and trying to be proactive around it. And, just to your numbers, and I'm not a scientist or a doctor, so I don't want to get into, because, you can do a lot with numbers, but I was just talking, one of he's not here now, our resource officer just left. His wife is a nurse, and she is doing duty in Louisiana because of this, and their hospitals are inundated, the children ICU. So all I'm saying is that I don't like to throw out numbers because numbers can be misleading, but there is concern. And the way, as superintendent, so I'm responsible for everybody, for your children, for your, people's grandchildren. And to have one child to die, to say that we haven't done what we could do, is unacceptable. That's why we're stressing the mental health piece as much as, talking about all the other steps we're taking, right? So I think we're on the same page. We recognize that. So our responsibility is to do what we believe the right thing is in this moment, right? And if you followed us last year, I believe we were extremely reflective. We changed travel guidance. We took a lot of time, and we were constantly updating because as new information came in, and our goal is to get back to whatever normal is, that whole term, new normal. I hope we can get back to what normal was. So, that's our commitment to the community, to you, that we're going to do what we need to do in the moment so that we can put this behind us at some point.
Yeah. Well, at some point we've got to say that the target can't move anymore. We've got to figure out what the target is and make our strides to hit that target. Because when it constantly moves, nobody knows you don't know what's happening. You don't know what when you're just doing it in the moment. Now you're just reacting to what's going on now. And the HVAC piece is, like I said, probably the biggest thing that's going to be the benefactor, I guess, of health in our schools as it relates to this, the exchange of that air. And that's great. But I got to tell you, the masks are no good. Just as well as I do that the kids don't like them. They're dirty. There's developmental issues with that. So we got to get our kids out of these masks. It's not acceptable. And we need pushback when you get questions, when you get directives or contact from the Department of Health to ask the Department of Health those tough questions. You say you don't want to throw around numbers, but but numbers are what's going to count. What's going to make our what's going to give us that target? Okay. I've taken up your time. I appreciate your time. I appreciate the efforts that the school committee and you, Mr. Levis, have taken throughout the course of this year. I do appreciate that. Thank you very much.
Thank you for your comments. Anyone else want to speak? See someone else coming down?
Rachel Mulligan, 2 Huckleberry Road. I'm just curious if you guys have any data on how many children were hospitalized in the state of Rhode Island because of school outbreaks.
I don't think that's something that we have on the top of our
That's not
heads.
something that matters in this situation.
I-
When
I'm
we're,
not
when we're
say-
talking about reopening and safety, you say numbers are misleading, but numbers are actually what we need to make determination. You talked about critical thought at the beginning of this meeting. I want to know what critical thought went through the minds of this committee when they decided to mask mandate our children. Or were you just doing what you were told and pretending like critical thought is something that we're going to promote in this town?
I think we have to follow the guidance that's been set by the governor,
Why is that?
because
What compelling piece of information convinced you that that was the right decision? Does anybody have one reason that that governor gave you that said, that's a good reason why we need to do this?
actually,
Hospitalizations in children, even in the teachers who are supposedly more at risk than our students. Were there any hospitalizations for our teachers last year? How can you not know that information and pass laws mandating masks?
I don't think that what might have happened in Coventry tells the whole story.
I'm asking for the whole state of Rhode Island.
I suspect the Department of Ed knows that. I
But they
suspect there
didn't,
are some.
but you didn't think to ask.
I
When,
don't-
when this meeting was going on, you didn't ask for any data to support their thoughts on how this should go.
Let me just say that none of it, well, maybe somebody in this audience is a medical professional but I am not, but I have letters from the Rhode Island Association of, American Association of Pediatrics, and we have guidance from the Department of Health. They've been saying this for several weeks. So they're
Saying what?
that they universal masking. They've been saying this. So
Why? We want to know
then-
why. We want to know what, we want to
then I
know
would
the data.
suggest
Do they have data? Are they providing you with data that shows the difference between masking and unmasking? Were there even schools that existed last year where students were allowed to go maskless? Is that data being looked at? It just sounds like everyone's being told what to do and they're not giving a reason for any of these rules. And you talk about critical thought. How are you going to explain this to these kids? Just do what you're told is what it sounds like to me. And it's disgusting. You look very comfortable up there without your mask. It must be nice to have that choice. My daughter couldn't smell or taste anything for months after school until I took that mask off her. I thought, oh, maybe she got coronavirus and I didn't know it. No, it came back after the mask came off. Miracle. She won't be coming back to school with mask mandates. I will be homeschooling her and her brother. And I will be offering my services of schooling to anybody else who disagrees with this tyranny. And you all were elected and asked to be here to advocate for our kids and to be a critical thought person in this town and do the right thing. And it's pitiful to see you all. It is. It's sad. And I came here knowing what the result of this meeting was going to be. But I came here to tell you that there are many of us that aren't here tonight that aren't going to tolerate it.
Thank you for your comment. Anyone else interested in speaking?
Regarding your questions about studies about masks versus not masked students, here's 8 pages of studies. The upshot is there's no difference.
Okay, thank you for your comment. Anyone else?
Josh Clements, 10 Gentry Farm Road. I just want to say thank you to this committee, the teachers, administrators, custodians, everyone that works to keep the kids safe at school. Had a great school year last year with my daughter. She wore a mask, didn't have any problems with it, learned a great ton. It was awesome. There's so many ways to keep our kids safe. Number one, vaccinate. I hope that the staff administration is fully vaccinated. I work from home. My company just rolled out a mandate. We all have to be vaccinated to even work from home. No risk in it. Hundreds, thousands, millions of people have been vaccinated without impact. And there's a group of people that cannot be vaccinated, that cannot be protected against this disease, and that is our children, right? So whatever we can do to keep them safe, I understand. I get the sentiments of the other members here who've commented that it may feel like this will never end. But there is a time when there will be a vaccine that's available for children, and we need to push to keep our kids safe and wait for that time. I understand that there are risks. I know that people are challenged in having kids at home. I've worked through it. I've done it. It's tough. It's hard. Vaccinate, ventilate. Again, great work. I've listened to this for a year now, talking about HVAC. It's awesome. I hope that there's greater future improvements in our schools as we work through the building bond. Spacing. I had a couple other comments. I don't agree with the sentiment that we need to wait until the hospitals are full to take action. The time to take action is now. We've been through this for 18 months. Started in China, it won't come here. Went to Italy, won't come here. It's in New York City, it won't come here. It came here, it impacted Rhode Island greatly. There are, thousands of people that died in Rhode Island from this disease. There are thousands of people dying currently in the southern states. I have family that live in Georgia. You cannot go to a hospital in Georgia right now. Does not matter. If you were in a car accident, they can't do anything for you. And I hate to think that would come here because we're worried about masks. Wash your mask, get a new mask, buy some more. I'll buy more masks for you. Whatever it takes. You worry about the mental and emotional impacts of masks on your children. What will happen if one of their classmates dies? That's the worst case scenario, right? There are other impacts of this disease. Thank you for the work that you are doing to keep our children safe. Thank you. One last comment. Please restore the Zoom session. I get in a lot of trouble for coming here and not being home to put my kids to bed. Thank you.
Thank you, Mr. Clemens. Any other comments?
Rich Vieira, 78 Chaplain Drive. So I'm not going to talk about the illegal mask mandate at all, but what I want to ask is you want things to go back to normal. I have my two kids went to Coventry High School here. They shut down hallways and you can only go one way. You couldn't go up this way. You had to go all the way around to go to a class that was right there. You're going to take away that? They're going to be able to go to class and walk around. They can be able to talk with their friends without being chastised by teachers and stuff. Are they going to be able to act normal? Or they're going to be like, no, you have to go down this hall, this hall, and go down 15 different places to get to your one class.
So we changed that at the end of the year. That's how, but that was part of the playbook that I said that the Department of Health had put out, that we had to control how people walk down hallways. Some districts closed different hallways. So you're right, it was, I did the same thing. I didn't get any privilege, except that was only during passing time. So if kids had to go take a break or something, but we changed that. So my expectation is we're not going to go back to that way. We're going to start off, and I think there was a comment before about normalcy. Last year, if you remember, I mean, we started off on September 14th and we brought in certain grades at the elementary school. And then we kept on adding, but it wasn't much later till October when our high school students came in, and then it was hybrid. So we're starting off everybody 5 days a week. So it's, I understand. I mean, I understand people's frustration. I deal with people's frustration every single day. And in my role, it doesn't matter because somebody's frustrated, right? So I hear what you're saying, but I think we're going to start with much more normalcy. I think the big issue is for us, I'm going to tell you, is going to be lunchtime and the mask wearing. That's going to be the big issue that people are going to have a problem with.
Illegal to mandate, so it doesn't matter. But the point still is, these kids need to be more normal. They need to be able to interact, have social emotional needs with their peers. you guys aren't going to do it. We're not going to do it as parents. It's the friends. I have friends that I've known since first grade that, get me through things when I need them.
Mhm.
Those are the kids, and they need to be able to interact and have friends be able to talk to them in calls and not be going, all over the place and rushing to get to class. And then when they get to class 5 minutes
Right.
late, 2 minutes late, 'cause they had to go through 15 halls,
Right.
teachers are getting mad at them. So
No,
I just wanna
I,
make sure there's normalcy.
I agree exactly with what you're saying, but that was something, again, none of us had dealt with this, and that was the guidance, and that every school,
But you're
every
talking about
large
the
school.
guidance now. So if they say, this is what we want you to do, are you going to push back and say, no, that's not right for us?
Sometimes whether we like it or not, I have to follow certain laws, and whether I like it or not. And I say this all the time, there
Well,
may
there's
be.
laws and then there's guidance.
Well, no, these are, but an executive order is not. And
An
we
executive
were
order-
mandated to follow certain guidance as we have plans that have to be approved. And so I think the governor today at least gave some, it forced the issue because we're between a rock and a hard place in a lot of decisions, right? Trying to make the best decision we can to ensure the safety of students, but also to ensure the normalcy. So, that's something, and we'll have a meeting tomorrow. We'll be talking about, like I said, what the guidance is, but it's more important. What does this look like in Coventry High School? What does this look like in Washington Oak School? We need to operationally define. So, and then have those conversations. We want kids to be able to be social beings. Last year, many students didn't interact with anybody, right? So we want to make sure that we provide the safest opportunity for students to not only come to school, but to stay in school. As Mr. Murray said, for some students, it was a revolving door. I'd see those names and they were out back in. 2 weeks later, they were close contact. I mean, we need to find ways around that, but also to ensure safety. So we take this seriously. This is not something, this is not just a checklist and just fill in the blanks, right? We want to know, well, how is this going to benefit students and staff?
When you say normalcy, I hope you're right. It's not just lip service for parents.
Anybody that knows me, I mean, at least I can say I don't believe in lip service. I'm going to say what I think I need to say respectfully and tell you why. And I think that's, to me, that's the most important thing that we can do, that I can do as superintendent.
Thank you for your comments. Anybody else?
I have quite a lot to say. I was at the State House today at 2 o'clock till 6:30 with the mandated vaccines. They're trying to push on everybody.
Could you go in front of the microphone
All
and
the
please,
nurses and
can you
other
please
people. Oh,
state your name and
Gail.
address, please?
And 12 Lane 3 in Coventry. And yes, so I was saying, I was up at the State House. They're trying to push the mandatory vaccines on the essential workers. And so I met all kinds of people that work at the hospitals who say those problems you guys are talking about just don't exist. The biggest problem at the hospital with them shutting them down from ambulances coming in is because the staff are quitting. And so they don't have enough staff to take care of the patients because they will not be forced to take a mandatory vaccine that will harm them for life because you can't take it. Once you're vaxxed, you can't be unvaxxed. I actually, since the man says there's no problems with the vaccine, let me give you a couple of, from the CDC, side effects of vaccines. You were pushing a vaccine clinic on our children yesterday in the high school, which I was very upset about. But anyway, let me read a few of the side effects from these vaccines. Death, anaphylactic shock, persistent malaise, extreme exhaustion, multi-system inflammatory syndrome. This multi-system inflammatory syndrome is an effect of the vaccines. The doctor who did the mRNA, Dr. Malone, said that they were expecting this. 3 weeks ago, he's the one that invented it. He said, we need to stop this immediately. We knew this was going to happen. They knew this was going to happen and they still did it. And they won't stop the vaccines. They're still letting this affect our children and our people that are on the street. Myocarditis, over 3,000 kids since this started pushing the vaccines on the children, which was only a couple of months, 3,000 kids dead with myocarditis, enlargement of the heart. That does not fix itself. It gets worse worse with age. That's what's happening to our children. Oh, no side effects. Let me see. Chronic seizures, paralysis, psychological effects, mood changes, anxiety, confusion, difficulty finding words, recent memory loss, and bizarre, frightening thoughts. Bell's palsy, Guillain-Barré syndrome, swollen, painful lymph nodes, thrombocytopenia, miscarriages and premature births among vaccinated pregnant women. They're losing their babies right up to full term. Severe headaches, migraines that do not respond to medications, cardiac problems, heart arrhythmias, tachycardia, sudden heart failure, strokes, visual problems, and blindness, encephalitis, encephalitis, and brainstem encephalitis, narcolepsy, autoimmune diseases, arthritis, joint pain, venous thrombolism, hearing loss. That's just to name a few. Oh yes, there's nothing wrong with these vaccines. As for your Delta, 75% of the people with the Delta come from vaccinated people, because what you've done is you've killed off your natural immune system that God gave you with that. And this other one is weakening the other parts of your body. So that's why you're getting worse symptoms from the people who have been vaxxed. They're getting it worse because they don't have the natural immune system left to do it, to take care of it. I don't see how you can say no side effects from this vaccine. Another thing I wanted to, well, let me go back to this. Knowingly causing permanent harm, forcing masks that do not protect or cause lifetime respiratory diseases, fear and emotional problems, suicides and family breakups. I didn't realize the amount of suicides was over 3,000. I didn't realize that. But I know I see all kinds of kids that are afraid to even look at people right now because of that. The emotional problems kids are having at home, amazing. The family breakups, I mean, family breakups, it's causing problems with the families just because the tension in the homes, because worrying about the kids and what's going on with these kids because of their fear and not being able to have their friends to socialize with. As far as masking in the buildings, the masks, it says right on the box that they will not stop COVID-19, but you're still forcing our children to wear them. If you look through a microscope at these masks, there's all kinds of little germs and particle things you can see moving under them. These kids are breathing these in over and over. The moisture in these masks when they're there, they're breathing that in and out, in and out. I'm 70. In my day, if you wanted to kill yourself, you took a pipe and you put it in a hose, you put it inside your muffler, then you brought it around and you put it in the window of the car. Then you had a bottle of booze so you wouldn't know when you died. We're doing that to our children every day. You're forcing them into those masks. You get brain damage from lack of oxygen to the brain. They had a man, a doctor with his son, and he had him take a test with the CO2 in there. Within 15 seconds, it was like 30%. Then a minute later, it was like up to 70%. Then it went up more. After 3 minutes, it was in a dangerous level, and you've got the children breathing this non-stop. It's affecting their brains. It's infecting their lungs. Don't tell me there's nothing wrong with that. With the other school meet in Burrowville that we're going to, some of the parents were complaining, the ones who have their kids in masks. And they said, if you put a mask on our child, if you don't make them masks, we're going to sue you. That was 23% of them. You know what? Someone got up. What about the 77% of the families of these kids who have been forced to use the mask? Their loss of 15 to 20% immunity in the first 6 months alone. What happens when the 77% rise up and get you guys because you forced our children? The different diseases our kids have got because you forced our children into this. That's appalling. These aren't your kids. This isn't just your kid we're talking about. We're talking about our kids. And actually, my kids are, I'm 70, my kids are grown. But I care for every single kid on this earth. And I don't think this is right. And I don't think you people should be able to do this without finding and searching your facts. Another thing I wanted to bring up, critical race theory. It's called bias training in Rhode Island. It's indoctrinating our children on hate and discrimination, making them think they're not worthy, that because you're white, you're no good, or you've been terrible all your lives, and it's a bunch of bull crap, and you all know it. A woman in Rhode Island went to the school committee, talked about it. You know what they did? They tried to sue her because she said, I would like a copy of the critical race theory you're trying to teach my child. So they're taking her to court to sue her? Baloney. I think every parent should have a critical race theory pamphlet of whatever you're trying to teach our kids before you dare to take it to the children. There's just so much evil that's going on, and you guys are perpetrating it by pushing this stuff on. Us parents want to know what you're teaching our children. As for taking the kids out of school, Healthy Choice, Rhode Island, has Amy Garden, who is in charge. She's now starting homeschooling. So anybody that doesn't want your children to be forced to wear a mask, which is an illegal mandate by the governor, you can homeschool your kids. There's lots of groups they're putting out. You can call them. They'll situate you with other people. You had that wonderful woman that got up and spoke before. Said she would be
Ma'am,
willing
ma'am,
to take kids into her home to
could
do
I
this.
interrupt you for 1 second,
You can
ma'am?
do this.
You're talking to us.
Oh.
And
Well,
if
you
you
can
could
do
kind of
this.
wrap it up, that would be really
I just thought
appreciated.
that I should face the people when I was telling them.
No, you're actually, you're commenting to the school committee,
Okay.
and the people
Well,
in
let
the
me tell
audience
you,
can hear
the
you.
people have the right to take their children out of school. If we don't want our kids forced to wear a mask and ruin their health, to worry about our children dying and having brain damage, then we need to take them out of the school system. When President Trump was in, he talked about taking them out of the school system and allowing the parents to get the money instead of the cities and towns getting the money for their children for school. It should go back to the parents, and they should take that money and put it to their own kids' schooling, whether they homeschooled at home or if they got a group together to get a teacher to pay for their own teacher. I think that's what this is coming to, because people have had it. I talked to people up the State House all day today, and we discussed this at length. This is what's going to happen. We are not going to take it. These are our children. We do not want our children dying because you people will not make a decision for them. It's not about some governor and what he thinks all of a sudden. You don't have an executive order is not a law. It is not a law. We have a constitution. We go by the Constitution in America. I guess that's all I got to say.
All right, thank you so much for your comments.
May I just say one comment? And I'm not going to get in this dogfight. But nobody's forcing children to have vaccines. I brought my daughter under my own volition, and we had a vaccination clinic last night. No one's saying on this school committee that you have to have your child vaccinated. So that fallacy is exactly that. And I take offense to the fact that, it's okay to have deaths with a COVID, but it's not okay with the vaccine. And I get it. But we've never said anything about mandating the vaccines. Are we encouraging it? If you want to have your kids in school, is it a protective measure? I chose it as a parent. That's my choice. And you have every right to pull your child out of school. Not advocating it, but there is homeschooling. My son's going to Father Doyle this year. There's masking there. So even if the government gave me a check, it's going to go to a private school that has masking, because that's a choice they made. So I don't want to get in a dogfight about this, but saying that we're forcing vaccinations and then putting out that information is just incorrect. And it's scary to other parents who may want to elect to have that choice. If you want to educate and sway those parents, that's fine. But scaring parents is not okay. That's all I'll say.
Welcome. Please state your name and your address, please.
Hello there. Ken Fogel, Coventry, Rhode Island. I have 2 kids in high school. It is good to meet you all face to face. I know you guys got a kind of a barrage of my communications during the school season last year, during the last school season. And at this point, I do appreciate, and I've learned a lot about coming to the last few meetings or hearing the last few meetings. I was at the one last week. The extensive work and the experience that especially the superintendent has. They're obviously very good with building structure and the HVAC system repair that you've been challenged with for the past few years. But to kind of follow up with the young lady who spoke earlier, I don't know where we got lost with our intellectual experience, education. It is extremely dumbed down. And I don't want to sit here and blame you people. These are all people who are part of this community. You all have, I'm assuming probably most of you have kids who have at least gone through the school system or are currently going through the school system with your experience, but the lack of leadership, I don't understand if it's a fear thing that is continuing through our society with all aspects of the last year's experience. I do want to take more responsibility as the public to the Coventry community to also take blame in this for not supporting and keeping in touch or paying attention to what goes on in this town, me included. But just seeing the experience of last year, the handling of it, I mean, we're all adults. There's a level of common sense, and I know there's a saying in our society today, in modern days, that common sense is not so common. And that blew my head up last year, seeing what was going on with our society in particular, and with the handling of people who are elected to be leaders and not seeing it. The governor, okay, basic history, civics, does not make laws. I think we all know that. I don't know.
Yeah, I'm having trouble.
I'm so very sorry. I have a very soft voice.
I'm
It's a
having a little trouble
condition,
hearing you as
unfortunately,
well.
right now. It's the executive orders that you all seem to want to hang around and just wait for orders is not a law. And it's not what runs your district. Okay, those are guidances, those are suggestions. Okay, and you need to take it upon yourself with what we, as the lady earlier said, critical thinking through your own experiences as adults. And just think for yourselves, what is best for our kids? This is what this is. You're educating our kids. You're responsible for that. Overlooking this. And what we've seen so far, I've been waiting for over a year now for people to step up and just take ownership. And it's been a battle, especially in my household, to deal with the lack of being American. We send kids in harm's way, our young children who dedicate their services for this country. Do we know why? Do any of us know why? The concept of that? Little basic history. Okay, it is to support what our founding patriots, our brave patriots, did for us to live in a free country. A free country, separate from tyranny, from a caste system, top down. We are the people. One nation under God, whether you like that or not. I know there's a problem within our society today with God dealing with that. No matter what you believe in, there's a creator. And this country was started through major sacrifice to allow us those freedoms. We need to have more respect for that. I hear people going around over this past years and half experience talking about respect to other people's hypochondriac characteristics. And we're turning our society upside down selling it for people who want to live in fear. That is not what this country is. I know all of you know this, or you need to be reminded of it. Get it? This is a stress. I know you're in a stressful position. But as leaders, you need to show that. Governors do not make laws, basic civics. They can give guidance. Okay? As a district, as a precinct, you have the power to do, you have that sovereignty. States have the sovereignty from the nation, but you must fall in line with the Constitution of our nation. That is the United States of America. You can't make your own laws that contradict basic human rights. Our Constitution, that makes this country great. Why we have what we have today. All I've seen in the past year and a half are people willing to not step up and throw that all away. So not only are we harming our kids in school, which is why we are here today, we're spitting at them for the ones that we are sending into service for our country also. I want you to keep that in mind. You're literally spitting at them and the people who have served for this great country. The veterans. Masks, coronaviruses, 0.06 microns to an average of 0.14 microns. That's the size of a coronavirus in variation. It takes an electron microscope to see this. There is no way any mask touches that. What it does do, and I'm sure it's common sense, but let's just kind of think about this here and reassure. It does block your airways. I don't think it takes a degree to figure that out. Masks have never been used for this purpose, ever. And there have been worse viruses in our society. So I don't know what it takes to get your heads out from between your knees. And I'm not just talking about you're all part of society, our community, the people in our community. It's basic. Doesn't take a degree. Masks are used in a very sterile.
I'd like to just interrupt
environment.
you for 1 second. I don't mean to be rude, but I think you could probably talk for quite a bit longer. And if you could just wrap it up, I'm very lenient with allowing public comment. Most committees say 3 minutes
No
and then
problem, I
you're done.
appreciate that.
So if you could just kind of wrap it up, we'd
Okay.
really appreciate it.
Okay. Masks just do harm, period. We know this. So I would appreciate those who just can't seem to wrap their heads around that, to at the very least of this board, this committee, to have a meeting and invite the public. You were talking about having an administration meeting with administrators, nurses. I know there are nurses who know this. I know there are teachers who know civics. For whatever reason, there's fear to speak up through these forced mandates, forced unlawful mandates for fear of their living. But we're going down a rabbit hole of what we're doing to our kids. I don't want to get into the whole design of it. where it comes from, why we keep falling for it. Right? All you gotta do is go back in history. So I thank you for your time, and I hope that we can get some sort of a meeting and invite parents, invite some people who have experience, common sense, a little bit of basic reading skills to put something together for Coventry. The data doesn't make sense. You can lie with data. There are many psychopaths who work in the medical industrial complex and beyond who master the book, how to lie with statistics.
Okay, thank you so much for your
Thank you.
comments, Mr. Fogel. Anyone else interested in speaking? Seeing no takers, oh, I'm sorry. Come on down.
Sarah Vieira. My husband just spoke a little while ago,
Okay.
78 Chaplain Drive. I've emailed you guys a couple times now. I've only gotten one response back. Thank you for that response. I have a lot of questions, and yes, I do know about the order that the governor has made today. And saying what Ken just said, Mr. Fogel, it's not a law. The last time I checked, and I'm a lifelong resident of this town. I graduated here. My mom, my uncles graduated here. My grandfather started a business here in the 50s. So I'm in it. I've been here and I've supported you throughout the years. But you don't know what you are making these kids do by wearing masks. I'm in it. I see it. My son came home with an infection in his mouth and could not drink water or eat food. He's 12. Do you have kids at home? Do you have a 12-year-old son? He cannot eat. I had to put him on a pureed diet. The minute school let out, the infection went away. Miraculous. My son told me today he does not want to go back to school if there's a mask mandate. He can't talk to his friends. The teachers have to yell at him if his mask isn't above his nose. It's not okay. I'm a speech therapist. Try doing a job as a speech therapist, teaching speech sounds to kids through a mask. Try having an IEP with parents and telling them you didn't meet your goals because I can't talk to your child. They can't see me. I can't see them. When is it going to stop? I have my email with questions on it. I will bring it up. Please consider these when you're talking to the state. The last time I checked, I voted for you to be in office. You work for me, not for the state.
I think you probably know this, but the K through 12 Council on Tuesday night voted for universal masking in schools in Rhode Island, and that any district plan, in order for us to reopen schools, we have to put in a plan to the Department of Ed.
I understand that.
And so I don't know what the repercussions are. I think the commissioner said that if we did not follow, she was committed to follow what the council had asked her to do. Obviously, legal counsel at RIDE was saying, I'm not sure if the council has that power, but they went ahead anyway and did it. And the commissioner said she would adhere to that as they are her boss. The ramifications would be we would not get COVID funding from the
Right, and it's a
from
numbers
RIDE.
game and it's a financial game. My three kids are not a number. They're not in this financial game. Honestly. How can you say that? You got to fight for the kids. This is about kids.
I can understand your point.
It's not about numbers. It's not about money anymore. There are so many studies
It's
that
not-
say masks don't work.
For me,
You gotta
per-
fight for us.
for
That's
me-
why I put you in that position,
For me personally,
honestly.
I agree with masking in schools. Okay, I've said it, okay? I agree with it. I
Then
agree with
back
it.
it up. Back it up. If you agree with it, back it up. If I can spend the time and send you guys emails with studies and things that I do on my own time, I don't want to be doing that for hours on the computer. I want to spend time with my kids. If you're going to say that, back it up.
I believe the CDC guidance and the
Then back it
American.
up. Get the study and show it to me.
Well, they've got plenty of studies. That's why they
Then
came out with the guidance.
Bring it next time to the meeting and we'll look at it.
So
I would love to, I
if
would love to see it.
If I may.
Yeah.
So I know
Please.
people want to bring out the studies and expect us to know every number, and I get that. I'm with you, right? I grew up here. I have my grandparents here. I go back to 1910, right? I was in the military. I was one of those people fighting for the country. I was in Iraq in 05. So I take a lot of offense to the fact that I called out on, every one of the boys that I served with would have taken a stick in the arm. I did. I took 5 before I left. And I wasn't asked, I was told. So, I take offense if people don't want to do that. But I hear you. What you're asking us for is us to make a health determination. It's not our job. Our job is to listen to everybody. We're elected
Exactly.
by a body, right?
But you're not
And-
giving me a choice here.
But
And neither is the
So for
governor.
every email I get from you, I get an email, I'll tell you, from a parent who's concerned about their kid and
Of course they
masking.
are. And
Right. And that's
you know
right.
what?
That's just.
That is just. I
Right?
agree.
So
But it's
voices
the
matter.
time for me. Fine. You want to wear a mask? Fine. That's your choice. What about my choice? What about my kid's choice?
And your choice matters.
I don't think it does.
I think it does.
Honestly, it doesn't.
But what I'm saying is that you have to understand us as like, and I'm not trying, I'm just describing the position we're in, right? We're not, you're making us a little bit of an enemy, but we're not your enemy. We're community members, just like you, right? But we're in the untenable position. When you talk about leadership, sometimes leadership is looking at both sides because we live in a democracy and there's always somebody who is going to be upset or somebody's
Well, then
child is
give
going to be
parent choice. If
disenfranchised
there's going to be people upset, then do choice. What is the problem with that?
because
Why?
some
Why
children
are you
don't
shaking
have
your
that
head?
choice
Why
because
do I
they're
have a
compromised.
choice? Why am I
Because
silent?
if your child comes to school without a mask
Yeah.
and another parent sends their child to school
So they're
without
superseding
with
my
a
child?
mask, no, listen, with a mask, then they're friends, and who's going to take their mask off because they don't want to be ridiculed for wearing a mask? That you've got to be fair across the board. You have to be.
No, beyond that, right? And I don't want to go too far down this lane because but
Can
what you're asking
can
us
I
to
just
do-
stop this conversation, please? Can I please stop this conversation? I'm the chair of this committee. And quite honestly, citizens' comments are to be made to the chair. And if someone wants to respond, they should ask my permission. So please, no talking from the audience, concurring, disagreeing, clapping, whatever. It's not an acceptable way to run a meeting. So I'm the chair. I probably shouldn't have even responded to you at all. Just say what you'd like to say.
Okay.
And I would ask that my committee stay silent unless you ask for permission
So
to
the
respond.
only thing I was just going to leave off with was one of my emails. If you're going to go back to the state, please consider all these different metrics to talk about. Give me 1 second, please. So what are the metrics for relieving children for continuous mask use in schools? When will it end? Will masks be used to coerce families into accepting unwanted other products? We're not talking about that today. I get it, but it's going to be down the pike. Will families be denied access to school? Will you turn students away who come to school without a mask or refuse to wear one? Are you ready for the legal realm that that's going to have and the ramifications of that? When are you going to ask for my input on these things? How long are you going to allow the government agencies with no personal investment in our children's well-being to usurp our parental rights? It is parents, not the Department of Health, who are dealing with all these repercussions, one of which I just explained to you. Vulnerable adults have options. Why don't children? Why are we forcing masking to keep them safe from what? Not a single child has died of any variant of COVID in Rhode Island during this pandemic, and that's something we need to actually celebrate. That's a fact. It's time to weigh the risks for the children against the injurious effects that we are making them experience by wearing these masks. And honestly, you need to come to the schools and look at it. Sit down, look at their faces, go to the classrooms. You tell me what you see. Thank you.
Thank you for your comments. Anyone else?
Good evening.
Good
My name
evening.
is Bethany Chatterley, 1763 Victory Highway in Coventry. Thank you for hearing us this evening. And bear with me as I work through some things. I come before you as a voter, as a concerned mother, as an advocate for a child in the special education program. So I wear a lot of different hats. So first of all, I would just like to say that, yeah, I love our town. I think our schools are absolutely wonderful. There were a few things last year that I'd like to address that I hope to never see again this year as a result of COVID. First and foremost, the school library was closed all of last year. I find that beyond unacceptable to deny the children access to books. Everybody knows that access to books is vital to their education, vital to their language development. Having that closed all year was something that I will not stand for this year. I would like to hear your commitment that it will be open. There is no reason for the school library to be closed. Secondly, on the bus, hearing that my child comes home and says, today I was rained on the bus. Snow is coming in on the bus because the windows are open. I was freezing cold by the time I got to school because the windows were open. That is not acceptable. When we talk about health of our students, we talk about health of our children, that's not keeping them healthy. And so I stand before you tonight asking on those two fronts for your commitment that we can make changes in those specific areas. When we talk about returning to normalcy, those are two areas I think that we can improve to return to normalcy. And I'd like to know your thoughts on that.
I'll let Mr. Levis
Sure.
respond to that.
Yeah, I think we were forced last year, and you know our schools, and I think our school committee members have been in our schools that we're limited in space. You know, some of our schools were built like Western Coventry, you know, parts of it 1948, and then, you know, with the most recent might be 1980, maybe. So we had to do some drastic, you know, we had to have isolation areas, and so, you know, again, this year we don't plan on being as drastic. You know, because we didn't have a library, didn't mean though that our classrooms weren't rich with literature. So I just want to be clear that we had to make accommodations, but we still had students still had access, but we didn't have that physical space. So I just want to be clear that students still had access to those materials. It just wasn't through the library. Might have been a cart or different things in different schools. But and as far as the busing, and I'll be honest, we'll look at that tomorrow. I haven't seen the transportation guidance last year was to keep windows, but not wide open. They would crack the windows. And we're fortunate we have newer buses that are propane, but the heating, if you ride the diesel buses, you know, depending on when you get picked up, it could be 20 minutes before the bus is heated up. These buses heat up immediately. The heat goes on immediately. So, but we can definitely talk because they were only supposed to be cracked. It wasn't supposed to be wide open, but just a couple of inches should have gotten the ventilation. That was the whole idea. So I can follow up with that too.
Thank you. Thank you very much. Some other things that I'd like to discuss, and I'm not here to argue about the mandate or argue about the masks or vaccinations. I have my thoughts. I'm sure you have your own. But I will say that I have some pretty grave concerns about my children, their social emotional development, their language development. As I stated, I have a child in the special education program. My child has a speech delay. As Ms. Vieira stated, children with speech delays and children in the special education environment are gravely impacted by these mandates. And I have some pretty significant concerns about how my children will learn going forward, how they've already fallen behind, and how they're going to be educated going forward. And I wanted to bring that to you. I think that there are a lot of things to consider. I can't imagine trying to consider them all at once. And I do have, a bias as a mother, but I want to bring these to you today. And I also wanted to ask you, when you meet with the Department of Health, when you meet with RIDE, when you meet with the governor, what are those meetings like? And the reason I ask that is I stand before you baffled about the mandate. I look at the numbers, I say, okay, 0% of children in the state of Rhode Island have died from COVID. So if I were in a meeting with you and you suggested such a mandate, I would very politely ask, what is the data that you have to back it up? How can you say this is for the health of our children without any information to back it up? So what I would urge you as a committee is, when you're at these meetings, to ask for some substance, to ask for something to back up the mandates and what they are asking for. And it doesn't make any sense to me as a parent. And I know that I can't go down to the Department of Health and knock on their door and get into a meeting with them, but you can. And we have elected you in these seats to do that. And I am urging you as a parent, as a voter, as a citizen, please push back against this, ask for the information, have a healthy discussion. Don't just be a panel that sits there and does what they're asked to do. Thank you very much.
Thank you for your comments. Okay, this has got to be your last time.
No, yeah, so I just have one last question.
Okay.
So last year, our kids are gonna be able to come to school if they have allergies. Last year, if they sniffled, they sneezed, if they coughed, they were sent to the nurse sent them home. They wouldn't be able to come back in because they get a test, which could take 2 weeks. What's gonna happen now? My son has bad allergies, and now if he's gonna wear a mask, obviously the crap is gonna be always on his face. What's gonna happen if they have allergies? Are they gonna be able to come to school?
Yeah, so part of it was knowing that, two things. One is I'm meeting with the nurses on Monday, so we can be clear about the guidance, because if you remember last year, guidance changed throughout. And our feedback to families and how we handle situations changed throughout the year. And we don't do this in a vacuum, whether you agree or not. When we meet in Department of Health and you need to, I can tell you our administrators push back all the time. They want normalcy. And so we don't like the fact that when kids, sometimes our administrators would push back with nurses. Like, one of the reasons we meet, and Mr. Wilson, the special ed director, myself, we meet just to make sure there's consistency, right? To push back, because we understand last year that we were cautious and we were concerned, and we didn't want any staff or students or your family members passing away, but we've learned a lot. So we'll be meeting and talking about that and making sure that we're clear about that and that we communicate that with not just you, but other families.
So what's gonna be the guidance though? Because again, my son, especially with the fall coming, has very bad allergies.
Right.
My kids have very bad allergies. Winter comes and of course they're out playing in the snow, hopefully what you want your kids doing, and they get the sniffles. They don't have the coronavirus, they have the sniffles. They have, allergies.
Right.
They're gonna be able to come.
But
to school.
we had students that had sniffles. Parents sent them in and then they were positive. And then the rest of the kids in that classroom were sent out, because younger kids mingle. They don't just sit in their desk all day long, right? So it was a lot of us. And so we'd have these conversations with the Department of Health. And that's when you saw it, because it was a period of time where it said somebody has an allergy, the nurse knows that, and we handled it that way. And then we get to that situation where where Department of Health had indicated this is how we're going to handle those situations. And it's easy for people to say, well, that's just guidance, but our nurses, it's just like if you have a doctor and your child has, the doctor asks the school to do something. We require like doctor's orders to get that done. We can't just do it. So our nurses work closely and they take to heart what's being shared. So, but that's a good point, a good question. I will make sure that when we meet Monday, we talk about that. Like how are we going to start off with that guidance
What's
for our
the plan
families?
If they do get sent home, let them to get schooling.
So we're going to be, one thing that I put in the plan in here, and I didn't get in depth, but we're putting together a testing plan. We're going to have teams that can test both symptomatic and asymptomatic, so that again, parents have to consent. We did asymptomatic testing last year and, maybe 20%, in some schools, maybe 20% of our students, it was very low, and we can't force it. We need parental consent. But this year we're going to fund through federal dollars a team that will go around and we'll actually be able to do the symptomatic testing. So if we think your child if we concerned that they may be positive, we would contact the parent and then we would have an opportunity to do that testing right then and there.
But will you have if you do send the child home and they can't get testing right away?
No, we can do but the parents will have the choice. I don't know how soon that'll start because everything takes time, unfortunately, but our goal is to be able to do that testing right in school, at a school. So it may not be at an elementary. Maybe we'll have you drive to the high school. Maybe we'll have a tent outside or they'll drive up and we'll be able to do that PCR, but that'll be your choice. Parents always have the right to go someplace else, but that takes more time.
But
Right.
they have to go someplace else.
But I'm hoping you won't. If you choose to come to our school, we can do it. That's what I'm saying. That'll be your choice to go someplace else.
So that but they wouldn't have school then until they get the negative testing.
Correct. But anybody, like if I have symptoms, that's just the way it is. I have to, if I think I'm positive, I need to be cautious. But, these are all things that we have to work out. And I know it's crunch time, but like I said, some of the guidance had changed, like close contact. There's some guidance that's changed around that. Quarantine guidance has changed. We don't want kids out 14 days. We don't want kids out 10 days. You don't want to have to stay home. So, we're trying to work on that. And anybody that's vaccinated, I know young children can't be, but anybody that's vaccinated doesn't have to quarantine, right? Doesn't have to quarantine. Pardon?
But they're a super spreader because they can still get it. They can still.
But I'm
pass it
not,
on.
see, that's like, I'm not a medical professional, so I'm going to deal with what's,
I'm just saying, I'm hoping that there's gonna be a plan if you send a kid home that they can still be able to get school if they need it.
right. And I mentioned that in ours. I know we didn't go in depth, but we talked about that children will have a education.
Thank you. Anyone else? Okay, I'm seeing no further comments. I will entertain a motion to schedule the next meeting.
Madam Chair, I make a motion to schedule next meeting of the school committee for Thursday, August 26, 2021 at 6 p.m.
We don't know yet.
at an undisclosed location as of right now.
I second the motion.
Can we have a roll call vote, please, Mrs. Martin?
Catherine Patino,
Yes.
David Florio.
Yes.
Luke Murray,
Yes.
Donna Colunian.
Yes.
James Pearson.
Yes, if we amend it to be determined,
Yeah.
not
Yes,
Not
to be
undisclosed.
undisclosed sounds like we're going to have a secret meeting.
Yeah.
To be determined. There we go.
That was a nice
Thank you.
addition, Mr. Pearson.
Thank you, Ms. Pearson.
Okay, is there a motion to adjourn?
Madam Chair, I make a motion to adjourn at 9:30 p.m.
I second the motion.
Could I just have a round of ayes?
Aye.
Aye.
Okay, motion carries 5-0. Thank you, everyone. Thank you all for